Oh, I've seen this before where makeup artists outline the lips and they take somebody who has lips that aren't super big and they make them look like they've had them injected with filler and they look so natural. This is just an odd color though. Anyways, they're gonna put me out of business one day. Maybe not.
I feel sad. I feel bad for the guy. I changed his whole life and he fell in love with me and I fell in love with him and now my feelings have changed. You don't think I feel bad that I invited all these people to this huge wedding and flew everyone out? I wasted everyone's time. You know, I wasted everyone's money, I wasted everyone's everything, and I feel bad. You don't think I feel bad?
This is what we call Botox crying face. Now, normally when you're making kind of that ugly crying face, your face kind of shrinks up and you have wrinkles all over due to that crying. But when you have Botox, your face can't do that. And it becomes this odd scenario where your lower face is crying, but your upper face doesn't move so much. So for example, I've got some Botox up here. It's wearing off so I can move it a bit. But if you Botox the whole upper face, none of that would move. And that's what you're seeing here. And I bet that if I cried in front of you right now, I might look a little bit like Kim.
Can you stay up all night?
Now, there are two substances that this person is circling on the ingredients of her shampoo: DMDM-hydantoin and dimethicone. Well, DMDM-hydantoin is known as a formaldehyde releaser, and that's why there's actually a class action lawsuit against one shampoo company for people who believe that that DMDM-hydantoin is causing their hair to thin and to fall out. Now, there is an argument that some people make that DMDM-hydantoin in small doses, like what you find in shampoo, shouldn't be harmful to your hair or your scalp or your health. Dimethicone, however, is a bit different. Dimethicone is used in a lot of skincare products and is generally believed to be safe. But some people believe that when it's in shampoo, it can clog hair follicles and that can cause the hair to thin. So in my opinion, I wouldn't be too concerned about dimethicone, but DMDM-hydantoin may be best to try to limit your exposure to it.
Let's talk butt vacuums. This non-surgical procedure is designed to enlarge and firm your booty. It lifts your tush while improving lymphatic flow and exfoliating your skin. My colleague said it felt funny, like she was clenching her cheeks but didn't hurt. It costs $149 for one treatment. The effects are temporary, but we saw immediate results.
Should you do this treatment if you want a plumper bottom? I don't recommend it. Now, this is an interesting thing where they are putting suction cups on your butt to try to suction your butt bigger. The problem is you can create some damage to the skin. You can get broken blood vessels and capillaries that may not go away if you have this done. So instead of using this, if you want your buttock to be lifted and fuller, I'd recommend one of the muscle stimulating devices like Emsculpt or TrueSculpt Flex. These are medical devices that have a proven track record for enhancing and lifting the buttocks. Never has a shart been so effectively acted. This has happened to all of us at one point or another, and I think pretty much by the time you reach adulthood, everybody has thrown away at least one pair of underwear from a shart. This reminds me of an old joke that a doctor used to tell me in the hospital. He would ask me, "Dr. Yoon, what is the most resilient muscle in the body?" And we would say the heart muscle, because it beats and flexes for, every couple of seconds really of your entire life. It just keeps beating. Then he'd say, "What's the strongest muscle of the body?" And he'd say the gluteus muscle because it's the thickest. Then he'd say, "What is the smartest muscle of the body?" It's the anal sphincter because it can tell the difference between gas, liquid, and solid. Most of the time.
These reads of my cauliflower ear until David Dobrik duets the video and watches. Took a little while and a bathroom change, but I got a little bit more. So go back in. And I think I got the last bit of it out.
Why is this so wrong? Well, it is true that he does have a hematoma of his ear, and that's a blood collection of the ear. If that blood is not drained, it can actually solidify and fibrose, and it can create what's called a cauliflower ear. You may have seen cauliflower ears on wrestlers, professional wrestlers, amateur wrestlers. Boxers have cauliflower ears as well, and that's where it's all kind of puffy and looks like literally a head of a cauliflower. But the main reason why this is a bad idea is because drainage of an ear hematoma should be done under sterile conditions by a physician. If that is not done sterilely and you introduce bacteria to the area of the cartilage of the ear, that cartilage can get infected. And when the ear cartilage gets infected, it can literally liquefy and the ear itself can melt. It could be an absolute disaster. This episode is brought to you by my skincare line, Yoon Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryoononline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video.
If you show a lot of gums when you smile, this is called a gummy smile. A gum lift is the most common way to treat this. This is where a little bit of the gum is removed. This also makes the tooth look so much longer.
What is a gummy smile? Let me show you. This is one way to treat a gummy smile, where you literally will remove part of the gums, making your teeth look longer. But another, actually much easier way to treat a gummy smile is to inject a little bit of Botox right here and right here. That can counteract one of the muscles that pulls the upper lip up and cause the lip knot to do that.
Okay, so I decided to get a BBL. So this was me a few days before my Brazilian butt lift. You can see I have some fat in my stomach and I'm lacking a lot of hips. So I have huge hip dips.
They're not huge.
Which makes me look a little
They don't
weird.
look weird.
Like
they're
my
very
body
normal.
shape's a little odd. Don't get me wrong, I love my body regardless, but you know, everyone has a little insecurities, and mine were my hip dips. I hated how square my butt looked.
So she looks great. She does not
hips.
need
So that's
anything.
what I wanted, to get some of the fat out of my stomach and give me some hips. So here is after my BBL. I'm seriously in love with how it looks. I wanted a very natural look, and you can see there's absolutely no fat in my stomach anymore. And my hips, there's not much hip dip anymore. So now when I turn around, you can see my butt just looks wider and rounder, and that's what I'm seriously in love with. Like, I just love the appearance of my backside now and my hips and the fact that I have no fat.
So I think we can all agree that she looked great before and she looked fantastic after. BBL surgery has been shown in some recent studies to have the highest mortality rate in plastic surgery. And this is because it's an operation where you take fat, let's say in her situation, from the tummy and you inject it into the buttocks. And if that fat is accidentally injected into the blood vessels of the buttocks, that fat can act as an embolus and basically go to your heart and your lungs and can kill you. So I'm not going to tell you not to do it, but if you do have BBL done, make sure it's done by an expert, somebody who specializes in that operation. You don't want to have anybody dabble in your butt. Did I just say dabble in your butt? Oh, I love these. So she had a nose job, and all that bruising, that is very normal. That's going to get better. I'm assuming this is every day as she progresses. You can see that bruising getting better, swelling coming down. Beautiful gal. Didn't need her nose done, but she wants to do it, and that's her deal. Here we go, waiting for the reveal. Excited to see how she looks. Here we go. Oh, she looks fantastic. Fantastic. Kudos to her doctor. These are some of my favorite videos because they show the actual transformation that people go through. Plastic surgery is not as easy as getting your hair done, and to show how horrible she looked initially, it really does take a lot of guts to put that out there. All right, whenever I react to TikToks, we always end the video with a couple of my own TikToks.
Hi, Dr. Yoon.
What the hell do you want?
I'd like to get some filler in my lips.
Fine, I'll do it. Quit asking.
What about a little Botox?
Oh, you want some Botox? You sure you want some Botox? I'll give you some Botox. I'll give you Botox. So yes, I was acting. I don't get mad like this. I think the only time I ever get this angry is never. How do you find out if you're a tough guy or just a puny weakling? The true test isn't how much you can lift, but whether you can undergo Botox injections without crying like a little baby. Watch me demonstrate. It's so funny, when I used to work a lot in the hospitals as a medical student and a resident, we'd have people come into the emergency room with big tats and huge muscles, and they would tell me that, oh, I'm afraid of needles, please don't do it. And they get so afraid. And then on the other side, you'll see a tiny little frail 85-year-old woman come in, and you get the IV in her, and she doesn't flinch. So just because you're big and strong and a tough guy doesn't mean that you can take pain. Did you have fun watching and reacting to those TikTok videos? Well, I definitely did, and I hope that you did too. So if you enjoyed watching that, take a peek at this playlist right up here, where I react to multiple different TikTok videos. Some mine, some other people's. They are going to make you laugh, they might make you cry, they might make you cringe, but they will definitely entertain you. And if you enjoy my videos, please subscribe to my channel, and remember to eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.